Hi, everybody. Sorry for the delay. We had a few technical difficulties. This is the story of the move to Zoom, the move to the virtual. It is not an easy shift. Um, Welcome to the Ethics of Now at home. It's like the Ethics of Now, except rather than ending by us going to have delicious chocolate-covered pretzels in the foyer with an after reception, your excitement will be the possibility of perhaps an elementary schooler or a hound dog bursting into our conversation. So you can sort of wait on tenterhooks to see if that happens. I am going to get us started. My name is Adriane Lentz-Smith. I am an associate professor of history here at Duke University. And I am going to be the discussant or the moderator for today's conversation on privacy in this period of the pandemic with Margaret Hu. I'll take just a quick second to introduce Margaret and then we'll jump in. So Margaret Hu is Associate Professor of Law at the Washington and Lee University School of Law, as well as a visiting professor at the Kenan Institute for Ethics. Her interests include they include the intersection of immigration policy, national security, cyber surveillance, and civil rights. Previously, she served as senior policy advisor, for the White House Initiative on Asian Americans and Pacific Islanders, and also served as special policy counsel in the Office of Special Counsel for Immigration-Related Unfair Employment Practices, or the OSC, which is part of the Civil Rights Division of the Department of Justice. You must have had a very huge business card. As special policy counsel, she managed a team of attorneys and investigators in the enforcement of anti-discrimination provisions of the Immigration and Nationality Act, and was responsible for federal immigration policy review and coordination for OSC. Hu has served in various leadership positions, including vice chair of the Kansas Commission for National and Community Service, as well as the board of directors of the Truman Library, the board of directors of the University of Kansas Memorial Corporation, the National Governing Board, the National Asian Pacific American Pacific American Women's Forum, and the Dean's Advisory Council at Duke Law School. Okay, with that, let's get started. We're going to talk probably for about 20 minutes. We're going to cover a range of topics, all of them timely, and on some level, I think a little sobering, but incredibly important. And I have a list of questions, Margaret, that I want to run through over the course of our conversation, but I thought I would start with a really open-ended conversation or open-ended question and just ask you, what are the issues, kind of big bucket, that we should be thinking about? And that might be things that that have come up a lot in media conversations or popular conversations, or they might be some things that haven't occurred to people to really process out loud.
Well, first, thank you so much to the Kenan Institute for Ethics for hosting this important conversation, and especially to you, Professor Lentz-Smith, for moderating this discussion. I think it's so important right now to talk about these issues of surveillance and pandemic surveillance in particular. And so some of the big issues that I think that we need to be thinking about are whether or not this move towards embracing epidemiological or COVID-19 forms of digital surveillance are really necessary, and are they going to work? Or is it possible that some of these methods of digitizing contact tracing, for example, is it just some type of move towards embracing technology just because it's convenient, just because there's assumptions that it's the most efficient or effective way of trying to address complex problems? And to what extent are these issues occurring within a digital economy and a system that really, I think, encourages us to think about data collection and analysis as just another form of profit maximization. So those are just, I think, some of the big issues that we should be thinking about when we think about, for example, automated contact tracing.
So do you think that these are issues that are specific to the pandemic or to COVID-19, or are these related to the same as broader concerns about technology and privacy, generally speaking?
I think that there are very broad-based concerns about data privacy, information security, cybersecurity, data protection, information security. All of these issues, I think, are ongoing. And as we're witnessing the rapid evolution of technological methods, the conversations become very robust in recent years about how to protect these things. But I think that this pandemic has introduced a real urgency in adopting surveillance methods. I think that there's a real need and desire to try to find something that will address these concerns quickly and efficiently, both for obviously the health reasons, but the economic costs that are huge that are being imposed by this pandemic. And so I think the embrace of data surveillance has a sense of urgency right now that has, I think, a real appeal. And because of that instinctive appeal of the desire to try to embrace something that seems like it will work immediately and effectively, and if these technological methods are available, why not adopt them? Then I think it creates almost a perfect storm where we just potentially run towards the embrace of these contact tracing methods without asking ourselves, for example, what does contact tracing mean in a historic sense? When we relied upon contact tracing traditionally, we relied upon human resources, skilled health workers who were trained in interviewing individuals and trying to diagnose problems and trying to be prescriptive in their approach. And it was truly a mitigating, method in pandemics. And with something that is purely automated or digitized, like some of these contact tracing apps that are being introduced, the real goal is more of a warning system, and it's not the true contact tracing method that we've seen in the past. And so I think that we need to compare and contrast what that means.
So part of it is about the absence of judgment, right? If it's automated, is that part of your concern? And does that absence of judgment, I mean, you could imagine someone having this idealized sense that without like sort of human judgment and or misjudgment, you might have less bias or things that distort that contact tracing.
Yeah, absolutely. And I think that because this virus, the nature of it, that it is something that is potentially asymptomatic when it's transmitted, and because of the rapid nature of the transmission, there's a real call for digitizing the contact tracing in order to try to keep up with the virus and trying to inform people as quickly as possible so that they can take action as quickly as possible. So it's fully intended to be life preserving. But as you said, there's a real absence of human judgment. And so the way that, just to back up a little bit, that some of these contact tracing apps are intended to work is that some of them, for example, are embracing geolocational tracking. And then those that are trying to champion a more privacy enhancing method of digitizing contact tracing, they're relying on Bluetooth technology. And so, for example, the proposal, this is something that probably people have already read in the news, but the proposal by the Google and Apple app would involve allowing for two phones that are in close contact with each other to have the Bluetooth signal through a rotating beacon number. They would, base these on keys on each device. And based on the proximity and the amount of time the two phones were in close proximity to each other, there would be the storage of this information, so that if later on a user who downloaded the app alerts their app with a tap that they have now been diagnosed with COVID-19, then, for example, the app might upload several weeks of these keys that were sent by the beacon numbers. They would send them out to other phones that were loaded in the system and notify individuals that they were in close proximity to somebody who's now been diagnosed with COVID-19. And so theoretically, this is supposed to be privacy enhancing, that it's simply just keys to a server, that this isn't, Apple and Google said this is not going to include identifying information. They said that they're not intending to store the data, and that once somebody gets the warning that they've been in close proximity with somebody with COVID-19, that they're supposed to receive information on, how to seek assistance or what types of steps that they can take to prevent further spread. So that's one of the digitized and automated contact tracing apps that are being proposed right now.
So I'm going to out myself as a totally 20th century person. I don't own a smartphone. I have a flip phone with buttons that I have because I specifically asked the guy at the AT&T store to go back in the back and find me a phone with buttons. So I hear this and it blows my mind, right? In a number of ways. It is both impressive and I think it is awe-inspiring in all of the things that might mean. And I say that because I want to ask you three questions that could sort of generate long answers in and of themselves. One, what are reasonable concerns to these kinds of technologies, right? Or these kind of innovations, these ways of pursuing contact tracing or other things through technology. What are reasonable accommodations to this moment of necessity? And then also, who gets left out or who has the potential to be left out if this is the way that we pursue figuring out where this virus is moving and how it's working, or who has it?
Yeah, so those questions are also important. I think it's really important to think about, going back to when you asked what are some of the big bucket questions, stepping back, and are we creating basically a car alarm before we've created a car or even recognize the drivers for the car? I mean, I think that, part of the question is, it seems like many experts have pointed out that this type of contact tracing that's digitized, that's, for example, Bluetooth driven, that it will only work if you have effective testing and if you have accurate testing. And so if you have accurate testing, if you have and widespread opt-in of this, and you have individuals that will take immediate action, I think that all of these if they fall into place, and theoretically, then you have something that might be very, very valuable. But if you don't have accurate testing, if you don't have individuals that really will understand, to what extent they might be subject to a false positive or a false negative, and then if you don't have individuals who actually take the steps necessary, would it have been better to just stick with the human skilled health professional who's trained in contact tracing, to sit down with individuals, find out who they know, who they've been in contact with, contact those individuals, find out who's the most likely to be infected based on human contact? For example, another limitation of Bluetooth, according to some experts, is that it can go through walls, it can go through car doors. So how accurate will this Bluetooth technology really be? So is it going to work? Is it really necessary? Or are we maybe better served by investing in sort of the more traditional historic contact tracing methods that are human driven and judgment driven and skill driven? And then, your other question of like, what types of concerns should we have about these types of technologies? And I think that the privacy and surveillance concerns are really huge. So this is not to disparage that I don't think that technology can play a real role. And I know that Duke and other institutions are working very hard to try to figure out, whatever research methods they have at their disposal, whatever technological tools and techniques we have, to fight this. And I think that that's so critical and that's so important. But I think that we do need to think about the ethics of embracing surveillance technologies and normalizing those technologies. And I think that, especially in a time of emergency, there's a real need to think about the legal consequences and the constitutional consequences of these types of technologies. Now, I know that a lot of these apps, they're intended to be privacy enhancing, but they're not bulletproof. And so, for example, IP addresses, could be used to track down individuals. And you can, even when you say something is intended to be anonymized, there are many ways to de-anonymize. And, will the information be shared? Will there be unintended consequences? Will there be mission creep? So you might start by saying, we're going to collect this information in order to fight the pandemic. But then eventually, are you going to potentially use the data for law enforcement investigations, for other risk assessments? And so I think that we really need to think 3 steps ahead before we adopt these types of technology. And then your final question about who is potentially left out in this technology. And I think that that's such an important question because of things like the digital divide and the fact that if individuals don't have access to smartphone phones, for example, but yet if this flips from a voluntary opt-in technology, which it is right now, at the beginning of the rollout of these technologies, everyone is saying it's voluntary, everybody says it's opt-in. But if the pandemic worsens and if there's a real push to mandate the use of these types of surveillance technologies, then are we going to end up with something that some other countries have been adopting, which is almost more of a punitive surveillance system, a way to shame people who have had the virus, a way to mark people in colors such as, red, yellow, and green. So if you are the highest risk of having the infection, that somehow you are marked in a red zone, and your certain rights and liberties and freedoms are being restricted suddenly. And if we also have this push towards mandatory surveillance for pandemic tracking or infectious tracking, is it possible that we're going to try to adopt more invasive technologies than this, especially for communities that don't have access to smartphones? Are we going to move to facial recognition technology, et cetera? So I think that those are such great questions. Thank you so much for asking those.
So what can governments do, or who would be in charge of using this technology and implementing whatever policies, right? And then alongside that question, what can governments do, and then maybe beyond that, companies who work with governments do to make meaningful commitment to protecting individual privacy while also addressing the problem of the pandemic? And I ask that question knowing that you, having worked in the government, understand that it is a giant entity with many, many, many different pieces and parts. And so maybe part of my question is, are there particular agencies, particular places, particular groups who have a history of or seem particularly well positioned to think through this problem solving?
Right. No, I think that right now, a lot of the push for the use of these contact tracing apps, for example, we'll just use the contact tracing apps as an illustration. They're being rolled out by private companies, and these private companies state that they are committed to privacy, that they are not intending to share this data in any way except for its intended use, which is to try to warn individuals that they've come into close proximity with somebody who's been infected by COVID-19. And so the companies do not have the same type of constitutional obligations because they are not the government. So, you know, the question that I think you're posing is, what if the government mandates it? What if the government takes over these technologies? And I think that there's going to be some very serious potential legal and constitutional consequences that we have to think through. Or what if the government demands access to the data? So we've seen historical precedent where companies try to protect data of their clients and their users, and then for law enforcement purposes, for national security purposes, and now here for health emergency, health crisis purposes, you can see the government, you can see a universe where they're going to start requesting this data. And then at that point, you know, your question of who is the best to try to safeguard the data privacy is a really tough one, because in the United States, you have agencies like the FTC, and the FTC is stepping in, by the way, and they are looking at these types of technologies, these health wearables, and protecting health data that's collected through various devices. And you have, you know, laws that are enforced to protect health data, such as, you know, the Health Insurance Portability and Accountability Act, HIPAA. You have like the Health Information Technology for Economic and Clinical Health Act. So you have, like, you know, various laws that try to protect health data in particular, but those are limited to certain health organizations like insurance companies and health administrators. And so I think that we might need, you know, legislative reform. I think that we might need to think very, very closely about the Fourth Amendment, and you know, whether or not this is considered eventually something that could be protected under reasonable expectations of privacy. It just depends on where this goes, what happens with the technology, how mandatory it becomes, how widespread it becomes. And so there's just a lot of questions that we need answered.
Right. As everything is go, 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 rush, 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 fast, 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 right? So we are burning through our time. We're almost out, and we haven't actually talked about the question of healthcare and the questions of privacy that accrue as we move more towards telemedicine and protecting kind of health data and that sort of thing. And so maybe just as a kind of quick closer question, she says, before she asks a big question, are the issues that that come or that might come with moving healthcare online, and the benefits that might come with moving healthcare online, similar to other issues of data privacy, or are they does that take us into a whole different realm of concerns?
Yeah, I think in some ways they're similar. I think that health professionals, especially now with, I think, cyber attacks and the real need to understand how to safeguard cybersecurity and information security in the information flows, making sure that health data is encrypted, making sure that there's proper risk assessments, making sure that there's data flow controls, who has access to the data, how long are you storing the data. I think especially when you're talking about health data, it's so sensitive. And so in that way, I do think that there's something very important as we move towards remote medicine and forms of analysis, including the use of algorithms and artificial intelligence in the way that we try to diagnose and try to treat for diseases. There's more and more of a run towards data, collecting data, analyzing data. So we had talked at the very beginning of the conversation about how there's a real embrace of that for profit maximization and what Shoshana Zuboff calls surveillance capitalism. In this age of surveillance capitalism, you know, it's all about the data. But when you're talking about health data, I think that, part of your question about what are the risks here, I think that the risks are in aggregation and in, I think, the sort of multi-generational and associational harms that can come through that aggregation of data. So if eventually there's a drive to try to do risk assessments based on, risky health factors, and including even like, DNA analysis, I think that could open a whole world of pre-crime and risk assessment that we really need to think very carefully about. And it could last long after we die because of the way that data can live on. And so it could impact communities and families for generations if we're not careful.
Wow, I just watched Westworld the other night, and I feel like you've carried us into episode 7 really, really well. And then as a final, my closing question, and then I will thank you all for being here. But it occurs to me that I've been posing these questions and thinking of these questions as very pragmatic or policy sorts of questions. Do you think that there's an ethical component to the answers? Should there be an ethical component to the questions that we pose and the answers that we find for those questions?
Yeah, absolutely. Absolutely. I think that, especially in the law, there's a real desire to just look at things legally and not ethically. But I think that there is, in a time like this, a real need to consider these as ethical questions.
Yeah. And I have to say, while these are extraordinary times, there's some part of me that thinks that the times like these for that consideration might be all times, that the extraordinary times shed some light, I think, on the everyday, even as they feel exceptional. I think I think we are at the end of our time. Margaret, thank you so much. I really appreciate your taking the time to talk with us about this.
Thank you for these thoughtful questions.
Oh, you're super welcome. And thank you all for coming, for waiting for us to bring you into the conversation and for taking part in the conversation. I forgot to mention at the beginning of the conversation that this is being recorded and that it will make its way, thanks to the wonderful team from Keenan, who's also here shepherding us through this process. It will make its way to the Keenan website before all is said and done. And we hope to see you again next week for another one of these conversations. We'll try to do them for a while. And in the kind of longer future, slightly further away future, I hope to see you all in person again someday back at the Durham Arts Council. So thanks, y'all.
Thank you.